Hey, Schaeffer Electric. My name is Justin Coleman. For those of you who don't know me, I'm one of the vice presidents of Schaeffer. I'm here today to share with you the new Schaeffer COVID-19 site policy and positive response plan. The goal is to give everyone a good understanding of this so that we know how to implement it and we can keep our coworkers and families safe through this crisis. Started off, all of you will have a copy of this PDF in the email that goes out with the video. If you need printed copies, we can certainly supply those. But for the moment, we prefer that you try and review and understand this from the digital copy to maintain social distancing and not spreading this disease. So, to start off our site policy and the basic understanding of it. Coronavirus disease 2019 is a respiratory disease caused by the SARS-CoV-2 virus. Periods of outbreak can affect all aspects of our daily lives, and we all know that right now. Schaeffer Electric is committed to continue supporting the construction industry workers and the American economy through continued on-site performance. We aim to be leaders and a resource for both our industry and community. As you know, this is an evolving situation and we are reevaluating these policies as the health and safety of our employees and community remains our top priority. If you have any questions, you can reach out to me or Mike Lucas. As we continue to monitor the spread of COVID-19, and the state and federal policies put in place, Schaeffer Electric would like to share some steps we need to take to help minimize the impact to our customers, employees, communities, and our industry. Anything that's underlined in red text is a link for additional information. The Occupational Safety and Health Administration, or OSHA, has concluded the risk of exposure to COVID-19 during an outbreak varies from very high, medium to lower or caution risk. The level of risk depends on the industry type, need for contact within 6 feet of people known to be or suspected of being infected with COVID-19. Under the OSHA classifications, the construction industry is considered lower risk. For example, a higher risk are our healthcare workers right now. They are required to be within 6 foot of contact of someone who may be or known to be or suspected of being infected with the virus. That means that Schaeffer Electric can continue its operations so long as appropriate health and safety procedures are followed, and this policy is supplement to Schaeffer Electric's existing safety and health and injury prevention program. So first and foremost, all employees should be aware of the symptoms of COVID-19 and the best practices for prevention at home and at work. You may find information about these symptoms of COVID-19 and the best practices for prevention from the CDC, or Center for Disease Control. So both of those are links to CDC's website that shows those symptoms and the prevention. Please click on those afterwards and take a look. So some general rules of thumb, or rules that we're implementing. Let's start with employees who have symptoms of respiratory illness. They are encouraged to and recommended to stay home and not return to work until they are free of fever, which is 100.4 degrees, or signs of fever and any other symptoms for at least 24 hours without the use of fever-reducing or symptom-altering medications. So this means you can't be taking cough suppressants or Tylenol to push that fever down and come into work. Employees should notify their supervisor as soon as possible and prior to their shift, and should stay at home if they are sick. All employees will receive full support for following the CDC recommendations for potential exposure or positive test results of COVID-19. If an employee learns that he or she has tested positive for COVID-19, Schaeffer Electric's COVID positive response policy set forth below in Section 3 should be followed. All employees are required to comply with Schaeffer Electric's site standards policy as appropriate for their workplace. Further, there are a few sites that have site-specific policies like SSM Garage and St. Louis Children's Hospital. Please get with your foreman or project manager if you need a copy of those. In the office, we're going to practice social distancing. Do not cross the door threshold to any office Please keep doors closed with your if you have an office door, and sharing of paper documents is prohibited. All joint areas such as break room and bathrooms will be disinfected each evening by ownership, along with handles, doorknobs, keypads, etc. And each employee is responsible for disinfecting their workplace at the end of each working day. Supplies will be provided. All customer vendor meetings have been moved to digital platforms, so FaceTime, phone calls, emails, Zoom, etc. All visitor meetings in office or on job sites are postponed indefinitely. Visitors required to enter the office or job site, please coordinate the visit with Mike Lucas. The visitor must not have been feverish, in contact with a person testing positive for COVID-19, or have traveled to a hot zone in the last 14 days. Employees with company vehicles are required to postpone ride sharing effective immediately. We also strongly urge employees to refrain from any carpooling in personal vehicles. Schaeffer Electric will cease all non-essential work-related travel out of state, while also strongly encouraging discouraging personal travel. Any employee with a pre-existing medical condition who believes that he or she is unable to report for work because of possible exposure to COVID-19, or because that possible exposure to COVID-19 poses a health risk due to pre-existing medical condition, should contact Mike Lucas for assistance in addressing the situation. So, our COVID-19 positive response policy. The following policy applies if an individual who has tested positive for COVID-19 was present on a Schaeffer Electric project site or at the Schaeffer Electric office. All employee information regarding medical evaluations, testing, treatment, or status is protected by federal law and must be treated as confidential. Only personnel approved by Tim Chettle, President, or myself are to collect and disseminate medical information about an employee. HIPAA rules are still in effect here. So the response process, the employee notifies myself of the positive test. So then I will identify close contacts, separate and inform impacted workers, inform our customer's project manager, inform non-impacted workers, and inform tradesmen partners. So, other tradespeople, plumbers, pipe fitters, you name it. I'm going to also identify areas of exposure, immediately stop work in those areas, post warnings, and thoroughly clean. The next step is to inform Schaeffer's president, Tim Chettle, local agencies, determine project-specific response, and review contracts and send official notifications. So below is a checklist of actions and steps for myself to take, but this will be a company-wide response. So we will communicate with the individual suspected of having COVID-19. If an individual receives notification of a positive diagnosis while at the job site or office, please isolate them in a separate room and provide them a mask to wear and send them home. We will confirm individuals receiving care they need. We will confirm areas and people the individual had contact with and during what time. We will determine if the individual knows when they might have been exposed. We'll confirm that the individual should not report to work and should self-quarantine to avoid contact with other people as much as possible to keep from spreading the disease. For Schaeffer Electric employees who test positive, Schaeffer Electric provides resources and certain benefits, including time off in accordance with the Family First Coronavirus Response Act. An employee who tests positive should contact myself or Mike so that a determination can be made about the benefits of which the employee may be entitled. If the individual is not a Schaeffer Electric employee, the individual should check with his or her own employer and or union to determine what benefits may be available to them, and confirm with an individual that they should not return to work until a doctor confirms it is safe. We are going to require doctor notes. So next thing we're going to do is we're going to identify close contacts. So identify persons in close contact with the individual with or suspected of COVID-19. The CDC defines close contact as being approximately 6 feet of a COVID-19 case for a prolonged period of time. Right now, I believe that is 10 minutes. Close contact can occur while caring for, living with, visiting, or sharing a healthcare waiting area or room with COVID-19 case, or having direct contact with infectious secretions of a COVID-19 case, so being coughed on. We'll separate and inform workers with close contact and provide direction. So Schaeffer Electric will inform those who were in close contact, both verbally and in writing, of the situation. And notifying others who came in close contact will keep the identity of the individual with COVID-19 private. Again, HIPAA laws are still in effect. The Centers for Disease Control and Prevention recommends that individuals who have come into close contact limit public activities. Individuals who have come into close contact should self-quarantine and work from home until they are symptom-free for 14 days from the day that they had contact. We've already done this with people who may have traveled out of the area, initiated this. So we're going to next determine if close contact should self-quarantine. So refer to the CDC guidelines. Again, we are not making these guidelines. We are using our resources, what the CDC, OSHA, et cetera, has to say, local authorities have to say about this, to determine if a person who has come into close contact should self-quarantine. People in self-quarantine should not go to work, school, or any public places where they could have close contact with others. We're going to inform people, clients, and subcontractors. So we're going to refer to Schaeffer Electric Communication Plan to report positive incidents. We're going to maintain identity of individual with COVID-19 is confidential, and we'll inform everyone working at the job site or office location of the situation and share facts of the situation and Schaeffer Electric response and ongoing steps to protect people. We're going to immediately stop work in the area and control the situation. So Schaeffer Electric Labor Manager Mike Lucas is responsible to stop all work directly associated with the area in question. The area should be controlled in such a manner to eliminate the potential for both worker and public exposure. A determination will be made by the Schaeffer Electric Project Manager, who could be Dave Bradley, Tim Bosick, Jerry Harris, myself, etc., as to whether a project or office will be required to stand down for a period of time. That'll also be coordinated with our customers. We'll reduce the spread of the virus, so we'll refer to the site policy for recommendations to do that. We'll engage company resources. So Mike Lucas will notify myself immediately, and I have the responsibility for providing support to ensure that core function, people, and skills are identified and that strategies are in place to ensure continuity of operations, similar to what we're doing now, where we're having groups of our office work remotely so that should something occur in the office, we can continue operations. And I'll monitor and comply with recommendations, requirements, and guidelines from the CDC, OSHA, and MDH with authority and expertise in the area of COVID-19. I'll review and comply with all local government guidance, including OSHA record keeping requirements. So some additional resources here is the OSHA COVID-19, which is 3990. It's a large publication, but it's robust, has a lot of information in it. The IBEW Media Center is putting out really good information on COVID-19 and how we can keep each other safe. The World Health Organization has a good list, and then also NECA has a resource center that we're utilizing to do our best to contain this. So this is our site policy. Again, the basics. We want to use the proper PPE. We want to, wash hands or sanitize on a regular basis, and we want to maintain social distancing. If anyone has any questions or concerns, please feel free to reach out. I'm doing everything I can to stay up on this. It's a minute-by-minute flood of information. So if you have any questions, please let me know, and we can talk and figure out next steps. Thank you for taking the time to watch this video and to review this further. Again, please click on some of those links after we're done and take a look at that additional information to educate yourself, your family. So please be safe. Thank you.